Welcome to Snackable Health with Dr. Gibson and Kohli, and we're talking about a COVID update. I know in our area, in Massachusetts, the wastewater RNA, COVID RNA, is climbing moderately rapidly. Caseloads in hospitals are climbing. And across the U.S., cases are climbing. So where are we, Payal? Why are we seeing this? Is this a new variant, or is this the same old variant?
Mike, we are seeing more emergence of the BA2 variant, which is that stealth variant, a subvariant of Omicron. But really, Omicron has become the dominant variant now in the United States. And this is not all that unexpected, given how our behavioral patterns have changed and given the changes with masks on airlines and in public places. So I'm not quite so alarmed yet. But I will have to say that I often get asked the question whether COVID has become endemic or whether it's still an epidemic. And a few things have to happen for something to be endemic. First, it has to be there all the time, which I think COVID is here to stay, especially because our immunity to it tends to go away. The second is that it has to be present at a certain specific predictable rate. And that's where I don't think we're quite there yet, because we're still seeing a little bit of noise going up and down. Now, certainly an endemic virus like the flu can go up and down, so we can expect some seasonality to it. But with respect to COVID, I think we still haven't quite settled out at that sweet spot where we have a predictable rate of what to expect.
And do you think this will be a peak across the country, or do you think, as I've said, it's probably going to be a bump?
I think probably the latter, because we've had so many people, both in January and more recently, already get infected with Omicron that some of them still have immunity. We do know that the immunity from natural infection can last anywhere from 3 months to 5 years based on the data. So we are seeing that. We're also seeing a second round of boosters, especially for those over the age of 50, which I think can also help to keep this infection at bay. The summer months are coming. We can do more activities outdoors. The virus itself spreads less efficiently during the summer. So I don't think it's going to be quite a peak, but I also don't think we're done with it yet.
Yeah, we may be done with COVID, but COVID's not done with us. All right. Thanks, Dr. Kohli. Thanks to all of you for joining us here at Snackable Health.